integrated NHS service and job centres to get more people working, a report says. We're going to read into this exclusive from The Guardian, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an exclusive from The Guardian with the headline of the integrated NHS service and job centres are to get more people working, the report says. The exclusive reveals that pioneering study says regime based largely on benefit sanctions has failed to tackle economic inactivity. Guys, while you're here, make sure you hit the like button and share this across social media so others are notified of this video. So, obviously, I think it's a good thing to integrate the NHS and the job centre, have a bit more connection there. It makes logical sense. One hand, obviously, is that we know that at the moment, we have a huge backlog within our healthcare service. We have a lot of people who want to work, but they can't work because of the healthcare. They're getting inadequate healthcare. Now, the hope in it is that as that backlog gets cleared, more people are able to apply to the job centre, more people are able to get back into some kind of work of some form, which will make a big difference to them, and that means less people having to rely on the benefits system as well. So that would be obviously, it's a benefit all around to have that. However, I also don't want to force people into work either. And there has to be a humane reason. Obviously, those with disabilities and certain disabilities or certain mental health issues, obviously they need to be looked at a lot more carefully when it comes to getting them into some kind of work, or any work at all needs to be done with greatest care and consideration. One of my biggest gripes that I have with the job centre is the lack of experts when it comes to finding work for those who have disabilities, who have mental health issues, and that they're not assessed by a doctor and they're simply just thrown into the walls by the people sitting behind a computer on the job centre without little to no care about the situation that those people are in, and with the assumption that they're just trying to avoid benefits. There is a small section of society, absolutely, that are avoiding going back to work, but the vast majority of the British public want to work. But the problem is that there's lots of barriers in their way. And obviously the NHS in the crisis that it's in is one of the biggest factors behind this. It's easy for them to say, oh, you should just go private to get the healthcare they need. Well, some of them don't have the income for that, and that's a really thing to point out as well. Like, people should not have to pay for healthcare when we have an NHS that we all pay in for in the first place. So let's read a bit more into this, you guys. So, ministers should integrate health service into job centres to unlock a hidden workforce of about 3 million economically inactive people who are without jobs, according to a pioneering research that could provide a blueprint for government's thinking on the labour market. The report, billed as one of the biggest single in-depth studies of long-term worklessness, argues that a regime based largely on benefit sanctions has achieved little, and any serious effect to tackle economic inactivity must offer personalised help based on health. Local NHS integrated care boards should be tasked with working alongside regional mayors to help people back into work in their areas, it says. The report from the Pathway to Work Commissions has been launched on Tuesday, but The Guardian has seen elements of its conclusions in advance. Interesting. So it is based on evidence on more than 700 people in Barnsley, South Yorkshire, who are considered to be economically inactive, defined by the ONS, that's the Office of National Statistics, who are not in employment, who have not been seen seeking work within the last month. Researchers also spoke to employers, experts and others as part of the project, which was led by Alan Milburn, the former health secretary under Tony Blair. While it was set up by local and regional authorities, it is likely resonance with the national government's priorities is clear. Other members of the commission, including Torsten Bell, the former head of the Resolution Foundation think tank, who is now a Labour MP, and the current and former Labour mayors of South Yorkshire, Jarvis and Oliver Coppard. Jarvis is now an MP. Milburn is understood to have been in touch with Liz Kendall, the Work and Pension Secretary, and Wes Streeting, the Health Secretary, with Keir Starmer's government keen to address economic inactivities as it pushes for higher growth. The year-long study notes that about 2.8 million economically inactive people across the UK are unable to work due to long-term ill health, whether physical or mental, and that while the reasons behind this are complex, health must be central to efforts to tackle the issue. Yeah, I think everyone knows that the healthcare is the issue there. Currently, it says the jobs and benefits system is simplistically based around targeting people with sanctions if they do not find employment, and focuses on those who are seeking work rather than the much larger groups, about twice as big, who are classed as economically inactive for health reasons. Policymakers had, in one commission source said, relied on toughening benefit rules to deal with what is largely a health-related problem, adding it is a legacy system that is stuck in the past. Too much of the work of Job Centre plus staff is to do with administrating benefit rules and getting people into any sorts of work rather than career progression or better earnings that ignore those who are economically inactive, the report says. Local areas should instead offer personalised support and advice to people who want to work and to employers looking for staff with a central role for NHS care boards. Milburn said the one-stick benefit sanctions approach of recent years has failed. The previous government pointed public policy ammunition at the wrong target. Unsurprisingly, they kept missing. With a new government in place and inactivity rates that show no sign of slowing down, this is the moment for fundamental change in direction. The country cannot afford to have a whole generation of young people coincide to a death devolve both of work and hope. Milburn remains influential in Labour and chaired the Social Mobility Commission for 5 years from 2012. The report comes as Starmer and his Education Secretary Bridget Phillipson were poised to launch a body called the Skills England on Monday, intended to bring cohesion to what is described as a fragmented system of skills training. So this will already be out. This skills thing will already be out by the time you see this video. With Richard Pennycock, the former chief executive of Co-Cooperative Group, announcing it as interim chair, the organisation is tasked with utilising central and local government as well as companies, unions and training providers to bring post-16 skill systems more relevant to the jobs market. Starmer said our skills system is in a mess, which is why we are transforming our approach to meet skills needs over the coming decades. And this will help to deliver our #1 mission as a government to kickstart economic growth by opening new opportunities for young people and enabling British businesses to recruit more homegrown talent. And definitely this is something that a lot of people prefer, especially those who have a problem with immigrants, wanting more British jobs for British people. And this will definitely, bringing them closer together, I think is a big thing. I'm all for more British jobs for British workers, but I'm also fully aware that we also don't have a workforce for some of these things. And yes, it requires training. And guess what? It takes time. These things take time, and sometimes the only way you have to train people up, as obviously, is with the government needing to put its hands in its pocket rather than telling the private sector to do it for them. Because sometimes the private sector will say, well, it's actually cheaper to bring them in on board for us rather than actually putting our hands in our pockets. So yes, on that regard, obviously that's quite a factor in that. But more importantly, just on this, guys, I think there is obviously more integrated. NHS and Job Centre can have a more integration there. Obviously, if it comes to helping people, especially when they're able to help clear their health issues that they need. But I do think there needs to be a bit more humanity when it comes to the people who work in these job centres. I hear far too many negative stories. I hear far too negativity from the staff and how they treat people who come in claiming benefits or looking for work, and how they speak and how they react to people. It's extremely annoying and frustrating, and at times infuriating as well. So there needs to be a culture change within the job centre. I really think there needs to be a culture change of some sort. Time and time again, I've heard nothing but bad stories from people who apply for jobs or claim benefits and whatnot. But what do you guys think? What do you guys make of this story? What do you guys make of an integrated NHS service and job centre to get more people working? Do you agree with this idea? Do you think it can work? Let me know your thoughts and more about all this in the comment section down below. If you found this video interesting, please hit the like button. We greatly appreciate it. Share this across social media so others are notified of this video. And subscribe, because it really does help support the channel. And if you want to go one step further, financially support me and the work that I do here, you can do so by becoming a YouTube member for as little as 99p. Or join me on Rumble or Patreon for exclusive content on those platforms. So thank you all so much for watching. I hope to catch you all very, very soon.